Hello, this is John Kanellopoulos, eye surgeon from Athens, Greece, and New York City, New York. I'm very excited today to share with you our initial experience with the Verion intraoperative tracking system and the Vision ICL, central ICL, Toric ICL implantation in this patient with very high myopia and high astigmatism. This is a -18, -3.5 diopter myope who, as you can see, is well dilated. We have the Verion device track. I'm checking right now with my technician if the data is correct, and here the device is projecting with this reticule on the patient live my main incision at 130 degrees and my paracentesis at 180 degrees, as you can see here. I'm also using my traditional manual marking, which is relatively close to the objective verification with the Verion, my manual incision here, my paracentesis, and we'll go on and load first the soft brush and then BSS into the implantation cartridge for the Vision ICL. We've been using it for the last 2 years. We're very happy with the results, excellent results. And now ProVisc in the cartridge, very careful manipulation with a toothless forceps to place the Vision intraocular contact lens by star. As you can see here, very careful not to bend or injure the haptics, and then push through very gently the lens and make sure that I'm following the orientation of the lens as it goes in and there's no rotation. Then locking on the injection cartridge onto the inserter, and then advance the lens, and again making sure that I can see the landmarks of the ICL, and I'm following those landmarks as I'm implanting here. Very careful for the lens to unfold correctly in place. It's very important for the lens not to be unfolded upside down. So you can see here very gentle unfolding. As I mentioned previously, the eye is filled with ProVisc, and I'm using a Kugelin hook with this curved, non-sharp edge to place the haptics under the iris, rotate the lens slightly. Whenever there's difficulty to place the trailing haptics, a little viscoelastic will make this a very easy job. You can see here how viscoelastic is pushing the ICL. I'm using irrigation aspiration on purpose in front of the central hole of the lens, the centriflow, in order to remove the viscoelastic behind the ICL. Spending a lot of time patiently in doing this. And after the irrigation aspiration step is completed, the Verion is activated and the position is confirmed. We have very good positioning here of the toric element of the lens, and as you can see, far better and more centered than what my manual markers are showing. I'm doing a fine adjustment here to reach the absolute same degrees on the Verion reticule projected through my right microscope optic, and here also confirming the lens centration as the device is able to sense the pupillary aperture. I'll go on to a second case, very similar to the one you just saw. This happens to be a case we had performed topography-guided laser and cross-linking a keratoconus that actually had significant anisometropia and was contact lens intolerant, so we decided to place a Toric Vision ICL. And again, the lens is placed, and here we're adjusting the actual axis, going in carefully and with the guidance of the device, using the projected angle on the cornea in order to make sure that the ICL placement is exactly on axis, and therefore increase efficacy of this very, very popular for us IOL implantation. And here again, confirming the markings on the ICL. You can see the pupil constricting after a little bit of myoclone. So I hope you found this presentation interesting. This is John Kanellopoulos signing out from Athens, Greece. Thank you very much for your attention.